Campus Fellowship webinar. So this time we have been joined by Dr. Ikram, who is the Fellowship Program Director of Interventional Cardiology at University of Louisville. Then we have Dr. Chaudhary. She's Associate Program Director at in Wisconsin of HEMOC, and then Dr. Nader will be joining us shortly as well. So he's a program director of GI in Arizona, and then we have Dr. Shakil. She's a program director of endocrinology in Methodist Houston, and then me and Gulrez will be moderating this session, and we have Dr. Noman Ashraf here as well, and then we have Dr. Asadur Rahman, who's the associate program director of GI in Cleveland, Florida as well. So I'm just going to go a little bit of brief overview about the fellowship match. I think most of you guys know that the fellowship will be application will be starting soon, and then you guys will start applying in July, and then most of the fellowship program cycle will the match result will come in November. Most like some in December, and most of the programs will let you guys know in December. So just going briefly over the stats of the fellowship, different fellowship specialties. So that's how it decides how people say how competitive the fellowship match has been. So regarding that, it was I think a couple of years ago. The stats are from 2021. So allergy and immunology, the match rate was 82% as compared to cardiology. The match rate was 69.7%, and critical care medicine was 65%, and then endocrinology, the match rate was 78%. So so basically these are the stats depending upon how many applicants applied for that year in that fellowship match.
Recording in progress.
Sorry.
Please mute yourself as soon as you join, please.
Sure.
Somebody joined the viewer.
Sure. And then we have gastroenterology, whose match rate was the lowest, 63.3%. And then we have geriatrics, the match rate was 87%. And then continuing on to the HEMONC, the match rate was 75%, ID was 96.7%, and nephrology was 93%. And pulmonary and critical care medicine was 67.8%. So going quickly, when I will just tell my example briefly. Initially, I wanted to do GI, but then I did the GI rotation. I think it didn't match with my goals. I decided in the late PGY1 that I wanted to do cardiology. So I think that's the best time that you should be able to decide in PGY1 what you want to do, so that you should have ample time, at least 1 year, to decide which field you want to go in, and so that you can do research, you can work with your mentors, and then you definitely make some connection as well, and then go from there. And then as you guys know, every specialty has the subspecialty conferences. PGY2 is the best time to go to those conferences. Best thing would be to present something. Once you will be there, you will make a lot of connections. You will meet program directors there as well. So that will help you a lot with your fellowship application. And then in PGY2, so start preparing on your CV. So the CV, personal statement, these things are really, really important, because now you are competing with all the residents. It's not like a residency match. So everyone has gone through at least 2 years of residency. It would be you would be judged really closely on your personal statement, CV. So these things are very, very important to look on, and then give your letter writers at least 3 months to write a letter for you, because the most important thing in the fellowship application is the program director letter. So that decides a lot of things, what your program director has written about you, because no one wants everyone wants a person who can gel easily, who works very hard, who doesn't make any trouble. So that comes from your program director letter. And then definitely you need really good letters from your other people, associate program director, your faculty. And so at least give them 3 to 4 months so that they can write a letter for you, because definitely otherwise, if you get delayed, it will delay your application. And then as I mentioned, the program director letter is the strongest one. And then so I will just quickly go what are the things important. So definitely the first thing which the program looks for is from which program you are coming. That's I think my understanding is that's the most important thing, which program you're coming from. What's the program name? Is it does that program has good exposure to the fellowship which you're going into. So because the people don't want you, people want people who are like well prepared for the fellowship, and definitely the name matters, from which program you are coming. And then the other important thing is research. Because subspecialty is like it's a very small field. So someone, if the program director is taking you, so he wants to make sure that you are really interested in that field. So the way to show that interest is by doing some research. And definitely I would say the number of research doesn't matter a lot, but the quality of research matters. It matters where you are publishing. It depends with whom you are publishing, because that's how you make connection, that's how you go up the ladder in academic medicine. So just I would say, don't try to publish in curious, try to publish in well reputed journals, so that the research matters as well. And excellent, at the end of, I think, as I already mentioned, LOR's connection and excellent mentor. So these are the few things I will touch at the last regarding the backup plan. So I think everyone should have a backup plan, so you never know what's going to happen. I myself I didn't match in cardiology for the first time, so I did advanced heart failure fellowship. So these are the few backup plans which you can do to get into the fellowship. I will just briefly touch base upon the cardiology, depending upon. So advanced heart failure, and there are a couple of spots of cardiac imaging as well. And then I will let other people touch base upon the other backup plans for their specialties. I think I would end here now. I will open up the question and comments from the panelists.
Thank you, Munis. So that was a very good brief overview of the fellowship process. What I plan to do for the session today is I want to open up the mic for the panelists, give them each couple minutes, see what their thoughts are about the process, how they can make themselves really strong applicants. And then I've collected multiple questions that I'll be posing to the panelists, and then we'll try to get answers for those. So let's just start off from the top. Dr. Nadir, if you want to introduce yourself and share a couple pearls about the fellowship process.
Thank you very much, Gulrez, and all others for giving me the opportunity to speak on this webinar. I am a Program Director of Gastroenterology Fellowship at Mountain Vista Medical Center in Mesa. And I think I was just hearing Munis. I think he said he was interested in GI, but then later on realized his passion was for cardiology. So I think the first thing is that you need to be really sincere in what you want to do, because anybody who feels that you are insincere, but you're trying to do something to prove something, is going to backfire, and you'll be wasting your time. So first of all, I think the sincerity of purpose is most important. And obviously, you will show that by your knowledge of the subject, because if you are interested in a subject and you have a love for the subject, then you would be very interested in reading about it and seeing those patients and acquiring that knowledge. And second is that if you are so passionate, you might have some ideas for research, because if you are interested in, for example, gastroenterology, and you feel that you're interested in, say, alcohol abuse, how it affects liver disease, so you might be doing something related to that, but it also has to come from inside. It does not have to be forced on you, or you're just trying to fill up the paper. Then I agree that trying to publish in garbage is going to backfire. So if you try to put something in Curious where there is effectively no peer review, I mean, a lot of times I take it as a negative. That means that, you are trying to just push it in to your CV. I would rather do a project, only one project, but a strong project, and publish it in a good place, or even show your effort, what you have done. I think that would be more important than anything else. So I'll just stop here. Thank you.
Thank you so much. Asad Bhai, I will take you up for questions. I will move to Dr. Shakil. brief introduction, few comments on the process, tips.
Thank you so much. I'm Javeria Shakil. I'm the Program Director of Endocrinology at Houston Methodist, going on third year as a Program Director. Our field, again, with endocrinology, I think everything that's been said is so pertinent to every fellowship, particularly something like endocrinology, because it's not something, in my experience, that's not, a lot of times, that's not the first choice for a lot of candidates, particularly because, after endocrinology, there's a lot of unknowns in endocrinology. So when we look at these applications, it's very easy to spot who is really passionate about it versus who's just doing it as a backup plan. We actually see, and I've said this multiple times, a lot of applications that have a lot of publications, not necessarily good ones in GI or cardiology or infectious disease or pulm critical care, and then they're applying for endocrinology. So it's very hard for, it's very hard to convince a program director that you're really interested in endocrinology when you have 20 publications in other subspecialties. Having said that, it's not wrong to switch your interest, like Amun said. My interest as medical student and internship was actually cardiology. But then when you are in the field, and when you're practicing and when you're seeing things, then you develop. Now I practice mostly adrenal, pituitary, neuroendocrine tumor practice, and it's an amazing field. It's a large field that not a lot of people know about. So we don't necessarily take that as a negative, but if you switch, there has to be a reason that could be explained well in your application. That's where the letter of recommendations and the personal statement, really come in. So just saying that, for everybody in leadership and program selection, candidate selection, they all can spot things that you might think is not easy to spot.
Thank you so much. Dr. Chowdhury.
Good morning, everyone. I'm Lubna Chaudhry. I'm one of the associate program directors for the HEMONC program here at Medical College of Wisconsin. I did my fellowship from MCW as well, and I will just echo everything that has been said. It's a combination of kind of reviewing your CV, what clinical interests you have, what research work published versus ongoing has been done, and really, just kind of looking at all of that in addition to once the interview is done, then really kind of going more in details. One thing I would say, sometimes if there is a gap between your graduation and then residency versus fellowship, there has to be some explanation. It's just easier to understand why there was a gap. And as long as you have a good explanation, even if it's, I was studying for the boards, because most of us understand that for IMGs, unlike people who are graduating from the US medical schools, IMGs usually start taking their steps 1 and step 2 after they graduate. So there's always a few, couple years gap in between. So just be aware that you want to explain it. But, the transition from residency to fellowship may not be the same as getting into residency. So if you've gotten into residency, you're already in the US system, and just, then other things are looked at, which I'm sure we're going to talk about more.
Thank you so much, Dr. Ikram.
Thank you very much, Munis. Can you hear me?
Yes, Dr.
Okay. So, Munis has summarized. First of all, I'm the program director of interventional cardiology at University of Louisville since 2007. And I have also served as interim program director for general cardiology as well as heart failure and EP also. So Munis has summarized all the salient features of program, but every program is different. As you know, that if you're applying, these days you're sending the same application to everywhere. One thing that I have seen over and over again is an unclear CV and unclear personal statements. So, when you write something, your own personal statement, and you're making your own CV, you think you have done a perfect job. So I have recommended to all applicants who contact me to show your CV to an experienced faculty member before you start sending it out. And you will be surprised at how many things they will point out that which are not correct. And like other panel members said that, don't try to put things in there which are obvious to the program director that you are just putting them in. I had an applicant who I was asking, whose name was in one publication and in the middle of the publication. So I asked him about that publication. He got up from his chair and looked over behind my shoulder and said, let me see which publication is that. He had no idea that what it was. So instead of trying to prove something by not being truthful, would be very obvious to an experienced faculty member interviewing you. So try to be very candid, very honest, and show your application to someone before you send it in.
Thank you so much,
There are
Dr. Ikram.
many other features that you need to look at. There are other obviously important things we can discuss later.
So while we have you unmuted, so I will start off with this question from you, Dr. Ikram. How can someone approach fellowship during residency when there is no in-house fellowship on the main campus? How would you recommend that a candidate should prepare themselves?
Okay, so that's a question which comes up, that whether you should be applying to your own program and that's where you want to be versus you're applying. So what you're saying is that if there's no fellowship program in your own program, right?
Yes.
And how again, the same thing, try to learn, whichever program, especially the ones that you get interviews. Like I said, initially, make sure that your application is very attractive and very honest, very candid. Once you get an interview call, try to know about that city, try to know about the faculty, try to know about anything that you can find out about the program, the research people are doing and all that. So the more you know about the program and the faculty before the interview, the better prepared you will be. So it's just like preparing for an exam, that, whether you scramble everything a night before the interview or you read about the program on website before. So it always gives a good feeling to your interviewer that he or she, their research interests and what they are doing. So don't ask an interventional cardiologist that how many TEs you are done in your program. So I think you have to be relevant, and I think there's no one magic advice that I can give you in terms of how to apply. But like I said, that just make sure that your application is very easily readable, and I think Dr. Our program director in hematology oncology mentioned that these your interviewers, people are very experienced and they will know that you're trying to sell yourself or you're really putting all the facts there.
Thank you so much, Dr. Ikram. I'll move the same question to Dr. Chaudhary. So Dr. Chaudhary, like if somebody doesn't have in-house fellowships, how can they make themselves competitive to apply to other programs?
Yeah, I would really add to what Dr. Ikram was talking about. And most of fellowship program directors or the team of people who are reviewing applications, we can identify and acknowledge whether an applicant is coming from a big academic institution versus a smaller community programs, and the expectations specifically when it comes to kind of the publications and research is different. So we acknowledge that, but if a resident is wanting to apply into fellowship and they don't have a fellowship in-house, start early, right? This is not where you're in your second year, residency super busy, but the earlier you start, the better it is, so that you're getting information on what are the programs looking for, what do you need to put into your CV. Now, it's a little bit, I would say it is an additional challenge, because compared to residents who have in-house fellowship available, they can then start working with those faculty members. They can start attending those clinics and develop this personal relationship and express their interest and work on a few, projects with those faculty members, and then apply internally. So people already know that this person has a good work ethic, they're interested in research. So that personal component is missing when you are really applying to all these different programs outside. But with that limitation, I would still say that, reach out to other institutions, identify, we have these big groups of residents and fellows and physicians on Facebook and Twitter. So you just have to be a little bit proactive and savvy to just try to reach out outside your institution to form those personal connections, even if it's one publication that you have shown that you can collaborate with the people of the subspecialty that you're interested in. I think that will be a big plus point. But just, be proactive and see what you're looking for and have a good solid CV and some research work to really show what you're interested in.
Thank you so much. I can share my experience as well. I came from a program that did not have in-house fellowship, so I had to work with centers which were much bigger, find mentors who can help me build my CV, and then closely work with my home institute as well. There is always research work available, and that's what matters at the end of the day, like how you have been productive during the 3 years of your residency. And would you continue to be productive? I'm not sure, Monis, where did you graduate from for your residency?
So at that time, I think in Michigan, they were just opening a new program. But as you mentioned, so try to find like some people who in that specialty, like let's say, take the example of cardiology. Like if someone doesn't have a cardiology in-house, try to go and talk to the cardiologist in your hospital. They must be doing some research. Try to find a person who would be good, who would be your good mentor. Mentor means like who will make calls for you, who's a early career physician, like who's well connected, who's going to the conferences. That person will be very important because he will have some friends who will be the associate program directors. He will have some friends who will be the program directors. So if you are able to do at least 2 or 3 case reports at least with him, and then do other research projects outside the program as well, like as Dr. Chaudhary mentioned, and doing some meta-analysis of the projects outside, that will be very helpful. And once you have some research projects, you go to ACC, AHA, the other conferences, then you can make connections and then you can go from there as well.
Thank you, Monis. So next question will be for Dr. Nadir and Dr. Shakil. How much research work is required for applying for fellowship? Is there a lot of publications that are required?
I don't think so. I don't think that you have to have like 10 publications. I think it's the effort. If the effort is genuine and you show that, I think that's important. So the effort can even be a good quality poster that you have presented that may turn into a publication, that you can see that this actually guy has really created this database. He has collected the data, he has analyzed it, he knows what he's talking about. Not that somebody puts your name on and you don't even know what is in that paper. Good quality case reports, as long as they are published in a peer review, proper peer review journal will count. A poster case report is not going to count. If you submit a case report in ACG where 99% things get accepted, we know that people have put that together overnight before the abstract deadline and they get it in. That's no effort. So when there is a specialty that has many candidates, especially for foreign medical graduates, when there are like 6 people applying for one spot, you are going to take the person who's going to be the best. And by the best is a person who's going to work hard, who's going to be sincere in advancing their education. And in my mind, who are doing it, practicing medicine to serve their community. I mean, yes, we all want to make money. That's fine. But on the other hand, you have to show your sincerity for seeing patients, that you really want to help your patients, whether this is cardiology or gastroenterology. I mean, you really want to help the patient. I see residents very interested, and I see their work ethic. They dart in the room of the patient and dart out in 1 second, they're out of the room. I already know that this guy really is not interested in caring for patients, just filling the paper. So research is important, the effort is important, the sincerity of the purpose is important. If you don't have a fellowship program in your institute, if you are really passionate, you will find a way. You will talk to the people, you will do say like a heart failure here that somebody did, right? and you will make yourself a better candidate if you're really interested. And then people are going to look at your CV. So I don't think people will take, there's a good word, disingenuous applicants who are really insincere, but they are showing something else. That is terrible, and I think that most of the people are smart enough to realize that. Thank you.
Yes,
Dr.
I definitely agree with Dr. Nader. It's particularly the quality of research. I would rather take one well-done study over 10, papers that there's third, fourth author on, and they don't know anything about that. I think one thing that gets not a lot of attention are your hospital QI projects, especially with endocrinology when we're dealing with diabetes, hypoglycemia, things like that. That really gets our attention when a candidate is actively involved in QI projects in the hospital, which are relatively easier to do than full-on big researches. The third point I wanted to mention is about I come from a internal medicine program where there was no fellowship in there. So one thing that our internal medicine program allowed was outside electives during residency. So that's another approach that if you are really passionate about it, your PD, your mentor, they know that you're interested in one particular field, ask them about if there's a possibility of you to go to an institution that attracts you to do like a month of elective there. So that has worked for a lot of my colleagues, went into very competitive fellowships, despite us not having fellowships in our own program. So for research, know your research. When you present it, I for one will ask about it, want to know what you did, what your role was, things like that. So like Dr. Nader mentioned, we are good at spotting who did the work and who didn't.
Thank you so much. Next question is, I got a lot of questions regarding research, so be prepared to answer on research questions. So next question will be for Asad Bhai, Dr. Chaudhary and Dr. Ikram. So you guys can chip in on the same question as well, like amount of work that is needed. But the question is, research related work, what sort of a research related work can make a candidate stand out? Does it really need to be published in JACC or Blood or like any of the bigger journals as compared to a mid-tier journal? So I'll start off with Asad Bhai, then I'll move to Dr. Ikram and then Dr. Chaudhary.
Thank you, Gulrez. I'm Asad Rahman. I'm a gastroenterologist at Cleveland Clinic in Weston. I'm the associate program director for the fellowship. So I graduated a couple of years ago. So I think this is a very valid question. I mean, because the majority of if you look at the statistics for IMGs, most of IMGs match in community programs where they may not be in-house fellowship opportunities, and also opportunities for conducting, research will be limited as well. So we have to take that into consideration. I think the program also takes that into consideration. So I think as long as Dr. Nader had mentioned earlier, as long as you've done the work, as long as you have made the effort, you will that will be reflected in your whenever somebody asks you about research as well. I would encourage everyone to make sure that whenever they put anything in their resume about research, make sure that for every particular poster or every particular publication, have like a 60 to 90-second pitch ready. I think that demonstrates that you know exactly what the premise of that study was, so that when somebody asks you, you are actually prepared for that. So, so I think if you are the first author or the second author in a study that was done by yourself, even if it's retrospective and is published or it's in the process of being submitted, when somebody asks you, that has a bigger, I think, impact as compared to being the seventh or eighth author in a publication that was published in the New England Journal or some other bigger journal. So I think that demonstrates that you had the ability to lead the project. You were able to, do the hard work in terms of data collection, analysis, and then subsequently writing the manuscript. So I think it may not be realistic for a lot of IMGs to, publish in bigger journals. You will always start with baby steps, with case reports and retrospective studies. I myself did the same thing. I did my residency in a community program without an in-house fellowship. And when I applied, I only had one retrospective study that was published, but at least I was the first author on this. So whenever people were asking about my research interests, I was able to basically expand on it very easily because I had interest in it. So I think that's what if I see an application where somebody is really has worked hard on it and they're the first or second author, I think I rate that higher as compared to somebody who is not the first or second author in a published study that was published in a bigger journal, but maybe was just part of the, data collection, etc.
Thank you so much, Dr. Raman. Dr. Ikram, your thoughts on amount of publications and which is more impactful, big name of a journal versus being first author?
I think the number of studies not necessarily, will make you more competitive. It's the quality of the study, and obviously the more high impact journal you can publish it in is obviously going to be more attractive to people. So again, the question of first are you there? I think I lost you for a second.
We can listen to you.
Okay. So I have seen many very good candidates make a mistake that whenever you're working with someone upfront, you should obviously you have to be working on that project wholeheartedly and contributing to it. Is ask them upfront that you will be the first author or the corresponding author. Most of the time, the faculty would be the corresponding author. But if your name is in 7th or 8th place and you have done a lot of work and you did not clarify it beforehand that you will be the first or the second author, then many times you may not be in that spot, which is obviously going to be more attractive to the interviewer than number 7th or number 8th on this. So be careful before you commit yourself, your time and energy, and you're not, put as the first author. So that is, I think, very important that upfront. And it's a little difficult question to ask your mentor who you're working with, but it's a very valid question, and I think everyone who's doing research should basically ask that they should be the first author.
Thank you so much, Dr. Ikram. Dr. Chowdhury.
Yeah, I would just add that I think there's no one size fits all, right? Having first and second author certainly catches your eye more than your name being somewhere in the middle, even though there are 10 publications. And a lot of times we can kind of pinpoint if you're kind of in the middle and it's the same subspecialty and 2 of those people are applying to the same program. A lot of times I've seen applications where I have both of those people in the application list, and one of them is always the first author and the second person is always somewhere in the middle. It really, I really pause and question, was the work being done by the first author truly, or was and the second person was just added because they were residents together. So sometimes that balance is important. So rather than having 10, 8, 10, 12 publications where you're really in the middle, I think being first or second author, even though there may be 4 publications, is more impactful. Journal, as long as it's a peer-reviewed journal, I think we don't expect these really high impact journals. I mean, if it's there, that's great, but we don't expect like NEJM or JCO or, kind of these big journals, because we know it's much more difficult to get into those journals. It has to be a practice changing study. I'm speaking from a med-onc standpoint or oncology standpoint. It has to be a really big practice changing study to make it into those journals. And so first or second author, a few publications, and then abstract presentations as well. You had a poster, you had some other things. One thing I would say, which always kind of, again, makes us pause, and not in a positive way, is if we have multiple abstract presentations. A CV would have like 10, 12 abstract presentations where they had posters in multiple conferences, but then it did not translate into a publication. And so that, to me, is kind of a negative, because it shows that this applicant was just busy. Abstract is easy to write. I mean, it's a 1 page, you just put it together, and it's much more difficult to translate into an actual paper. And so within the 3 years of your residency, you were, working on all these abstracts and presentations, but you didn't then follow through and publish. So at least some, even if it's a couple of publications from those abstracts, kind of shows that you were able to get that project to the end rather than catching up on more projects. So that can always be seen as a negative. The other thing can be, you can explain in your CV that these are all things that are either submitted or you're still working on them. But I would still say it's always nicer to have an abstract, but then also have a publication from that abstract. That just shows that you were committed to that research.
Thank you so much, Dr. Chaudhary. So moving on to a little bit of a controversial question. I will not assign this to anybody. Anybody can pick it up. Role of visa category and AMG versus IMG while making a rank order list. So that was one of the most commonest question asked, like, is there a ratio that needs to be set? How is this decided when making the final rank order list? I will leave this to the panelists, whoever wants to take, because it's a controversial one.
I just want to add. So I think I'm the three of us who are the young guys. I think Asad bhai, you guys did on H1, I did on I'm doing on J1. So I would say, I think go with the program, to which program you are going. So I have survived on J1. This is my 8th year of J1 visa. And believe me, I'm getting a job as well. I'm getting a good, respectable job. Although Dr. Ikram thinks that's the middle of nowhere, but still a job in Missouri. And I think everything worked out. So that's true. But I haven't been to Pakistan for 6 years, which I'm going like now. But I think it worked out. So I think, and then these days J1 waiver jobs are really easy to get. Not for interventional cardiology, but for other fields. Like people are getting like jobs in Louisville, like at University of Louisville, the waivers, people are getting the waivers, and like in the suburbs of Louisville. So I think for me, the program name matters a lot, because the program name will carry you a long way. It will, like, believe me, I went to ACC. I was meeting a program director. I said, I'm Munis Raza. He said, no, wait, from which program you are coming from? The people are looking for the program name. So I would not compromise my training. I would not compromise the program name just for the basis on visa. That's my 2 cents.
Thank you,
I agree with Munis that you should go for the best program, that you should make your chances. It doesn't matter initially whether you're on J1 visa or you are on a green card or non-immigrant visas or immigrant visas. We do run into problems sometimes when you have a limitation set by ECFMG. So I know of at least one instance where the applicant basically convinced us that he will have no trouble extending his visa status. And right before July, he had not been able to do that. And there were difficulty for us to start him on time. So he had to start off cycle. So I think as long as you have a good chance that there won't be any interruption in your status, it doesn't matter, which visa you have at that point.
So I think the question was more so from the program's perspective, like, does a program prefer a specific visa?
Let me take this, Gulrez.
Thank you.
It's a controversial question, but I think about it all the time. Foreign graduate from Pakistan versus an American MD. Okay, I'm a foreign graduate from Pakistan myself. I came to Pakistan, to United States, as a green card holder in 1990. I was behind a US medical graduate, in all honesty. I was behind. Maybe I was not a good student. I was okay. I think I was okay. But I was behind. Why was I behind? I think about that as well. I did not have 4 years of pre-med, right? In Pakistan, and I know Pakistani system a little bit better. In Pakistan, people do FSC or they do A-level, O-level, right? There may be some difference there. There's some people more privileged and they get better education based on their privilege. But then they come here and they are competing against a US graduate who has high school, then he's AOA student in 4-year pre-med, then he goes to medical school. And the education in US is very robust throughout, pre-med and med school. Our education, at least during my time, I don't know if things have dramatically changed in Pakistan. I don't think so. If anything, I think I actually give a lot to people like us, who actually somehow made it, and I give a lot to United States for making us equals here. But were we equal? No, we were not equal. So that is why a lot of us foreign grads have to take an extra step, have to work harder. When we are talking about research, a lot of research takes is writing English. And, I didn't have the skill set to write good English, which is precise. It takes time to learn. It takes time to think. So keeping all of these caveats, in my mind, I would take everybody who's serious and an applicant, I would take them seriously, but I would see how serious they are, really. What have they done? There are American graduates I have seen who feel very entitled, who are lazy. They are not going to get in. Okay. If I feel, sorry, I'm becoming a little opinionated, but if I see they feel entitled and they're lazy, they're not going to get it. And if I see a foreign grad who has really worked very hard, is humble, because research is a slow process. And if he's showing that really, really wants to do it and is passionate about the subject, I will take them. But I hope I answered it a little bit.
No, thank you for your thoughts. Looks like Dr. Chaudhary wants to add.
I want to add to that. I think from a programmatic standpoint, I have sat in multiple, application reviews and then rank meetings. And this question of whether this is a US grad versus visa has honestly never come up, because our IMGs at that point have already made it into the US system. They are residents in a US program, right? So unless there is an actual visa issue, like Dr. Ikram mentioned, that sometimes IMGs or visa holders are in the process of transitioning from J to H, and the program needs to sponsor that. And not every program does it. So that sponsoring may be a question. But otherwise, J1, H1, green card versus US citizen has never been a deciding factor at all, at least from my end. Whenever we have sat in a panel discussion, it's always been, what was their, where are they resident from? Are they a chief resident? That's always a positive. That just shows that they were so good in their class that they got a chief residency position. Looking at their research, looking at the program director letter, their personal statement. So all of those things that we kind of have talked about, those are the things that we review and then decide on the ranking. And visa status is not one of them.
Thank you so much, Dr. Chaudhary.
I
will move on.
Like to add just one more thing. Some of the
Yeah.
programs are explicit about it when you're applying, that they would not sponsor H1 versus, they'll only take J1. So for example, my program does not sponsor H1. But when we are making a rank order list, that is never, we know it's going to be either J1 or a permanent resident or citizen or things like that. I myself am J1. So, this is just make sure when you're applying, it's mentioned. Most of the programs will tell you that they don't sponsor H1.
Thank you so much. While I have you here, Dr. Shakil, does the repute of the program matters, and more so with respect to a newer residency program versus a historically known residency program?
That is a great question, and I think it absolutely matters where the residency was done, just because of the fact that it's a known program. It may have a reputation. We would know some of the faculties there, the kind of work that they're doing. But having said that, my subspecialty, like I said, I keep going back to endocrinology, which is again a little bit different than, let's say, cardiology or gastroenterology or pulmonary critical care. So it's a small community. We all know each other. So if the program has a reputation, we would know the program, and that matters. In terms of having a letter from a program director that you may have met in a meeting or things like that. Newer programs, it's not an absolute, oh no, what program is this? Again, we go back and look at what quality of work that they're doing, what kind of cases that they're seeing. Is the hospital big enough to give them that kind of exposure? But obviously the program name comes up, and especially when we are trying to do the rank order.
Thank you. Dr. Rahman, your thoughts on this?
Yeah, so I just wanted to add a little bit to that question about whether visa requiring applicants, they are at par with American graduates. I think it depends. I know several programs for sure in a 50-mile radius to where I work, where they definitely, I mean, they have had a track record of not ranking program applicants without. So it all depends on where you're applying. So I think no one size fits all. I think most of us are in are well-reputed, I think, academic organizations where visa does not really play that much of a role in ranking. But yes, I think there are places that do consider that. But as an applicant, I don't think that makes a big difference to where you rank programs. I think the match works for you, so you should still rank places where you want to go ultimately.
So the next question that I asked Dr. Shakil was like the reputation of the program that I'm asking you as well, Dr. Rahman, like newer program versus a well-known program.
It all depends where you see yourself in the future. You know, your life only begins, or your practice only begins after your fellowship training. So if you ultimately plan to go into the community and for example, if you want to be a gastroenterologist and you want to practice in the community setting, it probably may work for your advantage to work in a place which is relatively newer, because it gives you the opportunity to do as many cases as possible. There is no competition in terms of the procedural volume. As long as you have, that program has met the ACGME requirement, I think they will actually may work harder to make sure that you are a robust clinical physician. However, if your future plans are to go into academia, or to go into a place where you will be writing grants, I think that'll then maybe a well-reputed organization or a place where there is definitely a research track would be better suited for your long-term goals.
So thank you so much. I'm loving the fact that we are literally not only covering the program's perspective, but also the applicant's perspective for every question.
Yeah.
So
I want to add regarding the residency program. So I think I think the people are asking like which residency program to rank for a future fellowship. So let me tell you like quick one my story. So when I was interviewing for heart failure, I met the cardiology program director at University of Louisville. So he said, Munis, how many interviews did you have? I said I had 12 interviews. He said, you know why you did not match? Because no one knows about Spectrum Health. Although Spectrum Health is a huge institution in Michigan, he said no one knows it outside the Michigan. So I think the program name matters a lot. A program repute matters a lot. If you're going to for a residency, if you're going into like a good residency program, I think that will help you a lot for the fellowship as well.
Adding to that, when we are interviewing people for cardiology or any procedure-related specialty, it does matter whether you're from a community program versus a university or a high-tech program, because you can imagine that a program that has a heart transplant fellowship and has a advanced EP fellowship and all the other subspecialties in cardiology, even hypertension, lipidology fellowships, the chances that a resident in that program coming from that program will have exposure to all those specialties. I've seen excellent candidates, but they had never seen what an ECMO is, or they have never seen an Impella malfunction in a ICU setting. So we feel obviously very comfortable when a resident that we are interviewing who will be our fellow is starting first month, he could be in the CCU to have exposure. Of course, there's always backup available, but I think it does matter, and we do look at those aspects, that what their exposure as a resident had been to what kind of patient population.
Thank you so much. So the next question is, sorry, where did it go? Oh. So the next question that I have is the importance of personal statement in the application process. So I'm going to let Dr. Chaudhary take this one, and then Dr. Nader. And this question follow-up after this would be the step scores, so that we can kind of like complete the application aspect of this. Then I'll ask Dr. Shakil and Dr. Ikram.
Sure. Personal statement is always important. I think when we review applications, I always look at personal statement and the program director's letter along with like scores and other things that we'll talk about. Try not to be generic, right? I've seen many personal statements that looks like, it's off of a default personal statements from Google. So it has to be a personal statement, right? You have to convey your passion. And I can speak from an oncology standpoint. I think it's maybe this thought somehow embedded in applicants' mind that they have to have a cancer history in their family to express their passion. And if they don't, I have seen people make it up. Like, you can tell that they're lying because, I had an applicant where she talked about a cord transplant like 30 years ago in Pakistan, and it doesn't happen. Like, the timeline was so off that you could tell this person was just making it up. So you don't have to have a family history of cancer to express your passion. It could simply be that I worked with this mentor in my residency, or I rotated in a clinic and I really enjoyed that rotation, and I developed interest and passion for oncology or whatever the subspecialty is, right? So keep it honest and keep it simple, but at the same time, highlight things that could be different in your application, your background, your cultural background, your family background, what your parents did, like anything which would add to that. So it has to be a personal statement, and try to stay away from just generic default stuff.
Yes, I agree with everything Dr. Chaudhary is saying. We all I at least look at the personal statement first, and then I match it with the program director letter and with the CV and try to make the big picture out of the candidate. And typically I will review this stuff at the time of granting interviews. So if there are 200 applications we have reviewed, and we are going to interview 40 people, we look at that before we decide which person is going to interview, and I actually make notes. And when the interviewer is coming to interview, I have my notes in front of me before the interviewee walks in the room. Because I feel that I have 15 minutes with the interviewee, I should do justice because they came all the way to interview. I should really know them, and then I assess their body language to try to figure out if this person is going to be a good fit or not. And the reason is it's a 3-year commitment. It's like living with your family. You don't want to be an unhappy camper. I don't want to be unhappy. I don't want you to be unhappy. So personal statement has to come from your heart. It has to be sincere. It has to be straightforward. Please don't be wordy. If I have to look up an English word during reading your personal statement, maybe I learned something, but I think you're trying to show off, you can use English words that are pertinent, and I don't know every vocabulary word, but not wordy, not very long either. It has to be readable so that it finishes in one page. Thank you.
Thank you so much. So the next question is regarding STEP scores. So I'll ask Dr. Ikram and Dr. Shakil to kind of weigh on it. We can start off with Dr. Ikram, but do programs have specific cutoffs for STEP scores? And is there a role for STEP 3 scores more than STEP 1 and STEP 2, especially with STEP 1 being pass and fail at this point?
Yes. So this has always been an issue. When you're applying, when you're interviewing people for cardiology fellowship, the question comes that why are you even looking at STEP scores? A person has already gone into internal medicine. They have been training scores and all that. I think the reason the ACGME has kept those scores is because it's a standard. You have to draw a line somewhere, and everyone's CV and everyone's personal statement may look outstanding, but one person may have much higher standardized score than the other person. I think the management or the people who set all the standards, they saw repeatedly that the foreign medical graduate scores in part 1 and 2 were extraordinarily higher than US graduates. And I have seen it consistently that if part 1 and 2 scores of FMG or IMGs are higher, and then they drop significantly in step 3, which is more clinical. And on the other hand, it's the exact opposite for US graduates, that their step 1 and 2 scores are lower, and then their step 3 scores are higher. And program directors definitely, in our program at least, they value the step 3 scores much more than 1 and 2 because that's close to your clinical skills and clinical knowledge. So I think it is important for the applicants, foreign applicants especially, that make sure that you work very hard on your step 3 because that will weigh more than step 1 and 2. And now they have changed it to pass and fail anyways. So they have eliminated that bias, you may say, in the mind. Say if I see an applicant with 99 and 99 in part 1 and 2, and then they drop to 72 in step 3, that is a red flag, obviously, that that person clinically is not as good as he has done in part 1 and 2. So yes, that does matter. Anyone else want to comment on
that?
Oh yeah,
I think I was gonna. So, yes, the programs will have a cutoff for scores. It is impossible to review all the applications that come through. For example, last year for 2 spots, we had over 600 applications. So there has to be a set where we start reviewing those applications realistically. Having said that, if the scores are low, especially again with endocrinology, if there's enough research, enough interest, and that's where a personal call from a program director, a personal call from a faculty would really come in handy. So if a candidate is having their program director reach out to me that, hey, this is a great candidate, could you look this, over the CV? That's where that'll help. But yes, the programs will have a cutoff for scores. The other reason for that is, especially in our subspecialty, we've had really terrible board pass rate for the last couple of years at least. Whether it was due to COVID, whatever the reason was, but we haven't really recovered more than 75% board pass rate. So passing a standardized test with good scores is a predictor of how you'll do well in the standardized test for fellowship. That's why we kind of look at that as well. And like Dr. Ikram said, step 3 carries a bigger weightage than step 2 score at this point in time.
Thank you so much. There are some people who are asking questions regarding non-ACGME accredited fellowship, especially after their home experiences. This session is more so for ACGME accredited fellowship, so we can answer those questions in the APNA YPC group on Facebook. So please post those questions over there and we'll be more than happy to take them. My goal is to wrap this session up in the next 15 minutes. I have a couple more important aspects to talk about. Letter of recommendations. What does this panel feel about? What makes an LOR stand out? And who are the best letter writers that one should consider? I will start off with Dr. Rahman, then I will move to Dr. Chowdhury, and then I'll take one more comment from Dr. Nader or Dr. Ikram.
So I think the first aspect is what constitutes a good letter. I think the letter should be personalized. Many times these letters are waived. So you really are requesting folks who you really are confident that they will be writing a strong letter for you. Strong letters, when we look at them, they contain individual examples of basically excellence in patient care. So they do sometimes carry anecdotes. They really, if they are from somebody who's a research mentor, it describes their ability to really carry the project forward. It describes examples of their leadership in that particular instance. Sometimes, strong letters may also be given by folks who basically they're not from their same program, but they rotated with them as in a way resident or maybe an away mentor with research support. So I think it has to be personalized. It has to describe specific aspects of the patient, of the applicant's overall application strength, as well as their personality as well, that describes how good of a candidate they are. Of course, the letter has to come. One of the letters has to come from the home program director. Many times, especially in today's day and age, we see a lot of standardized, templates where the program directors are just, filling in their 6 ACGME core competencies and their performance in each one of them. I mean, sometimes that letter can be very long and difficult to decipher, but I look at maybe a little part of it at the very end that describes their personal traits. And I think that is very, very important, because sometimes they will give you hints about a particular person that may be negative or positive. So I think the program director letter is something that is, of course, very, very important. But I hope that whatever letter you get describes, I mean, specific positive traits as a resident. Then another, important letter that we do consider is from, if you have a home fellowship institute, from their core faculty whom you worked with. Again, what I look for in them is, if somebody has worked with a fellowship, faculty, how good of a job did they do? If they describe anecdotes where they were working as hard as a first-year fellow, where they did not say no to any particular thing, if they, not that they want to violate their ACGMA hours, but they were able to facilitate the inpatient team, that speaks volumes of their candidacy. So I think that's important. So people who you work with personally, who can really vouch for you, and if they're comfortable, they can actually make phone calls for you once, you've got an interview someplace to really showcase your ability as a resident. I think they would be key attributes. So I think many times it's one internal medicine, maybe even two internal medicine with two specialty letters of recommendation that most people use.
Thank you so much. Dr. Chaudhary, your thoughts?
Yeah, I would agree with what Dr. Rahman said. Choose your letter writers wisely. Don't just, and give them enough time, right? Give them enough time to work on those letters. But in addition to the program director letter, I think having a couple of just IM letters, but then, as Dr. Rahman mentioned, having a letter from a faculty of the subspecialty that you're applying for is very important. It really tells the reviewer that this applicant has taken proactive steps to already start forming relationships within the subspecialty that they're applying for. So I think having that specific letter would be important. Now, at the same time, you have to choose people that you closely worked with. You have an ongoing project, or you published something, or there was a poster, or you worked with their inpatient side or clinic for 2-3 months, so that they had time to evaluate your clinical skills, your ethics, as well as your research interests. So just choose that wisely and be proactive about it.
Thank you, Dr. Ikram.
Yes, I will actually use a corollary of this question, that what you should avoid in terms of LOR. So like everyone said, that be very careful who you are choosing. I have actually literally seen negative letters being sent because the applicant had waived their right to see the letter. So whenever you're, it's not uncommon that there are 4 applicants applying from one program. And it's very easy that if I have 4 applicants from program X and the same program director has written a letter, you can immediately see that what they are doing in terms of making their own rank order list, in fact, by writing a letter for all 4 of their own candidates. So I can tell very easily. So when you are requesting a letter of reference, please make sure that the letter writer should describe the unique skills that you have. Everyone is a good moral character and they are all pleasant and all that. But important thing is what sets you apart in the program. What did you do differently? And you may have to actually prep your letter writer that these are the things that you did which will set you apart. So I think we all look at personal statement. They're just a rehash of their CV, or even in the letters also. Sometimes they are a generic letter. They're describing which medical school you graduated from and where you were in the class. At that point, that's over. Now we are looking for what your skills are, what your personality, and like other panelists said, that's important.
Thank you so much, Dr. Ikram. So I will be asking like a rapid fire now, because there are a couple of questions that have come in live. So Dr. Nadir, role of chief resident versus or doing away electives?
Chief resident is a political position. For the slot. If somebody has done an elective and they have done research and they've learned more rather than learning politics, I think in my mind that I count more. Thank you.
Dr. Shakil, your thoughts?
You mean chief resident year, extra chief resident year versus away electives?
Both aspects of the
Oh yeah,
application.
so chief resident, either a third year chief or a fourth year chief I take that as a positive because that is their leadership capabilities and their ability to work as a junior faculty with the rest of the team, ability to train them, especially when the fellowship is really small. So we do need to have that extra set of skills. So to me, that's a positive. For away electives, if your own program does not have in-house fellowship, that's where it'll count. If your program has in-house fellowship, then it may actually be a negative because why you didn't do it in your own program. So that's where it'll come in.
Next question is role of like most of us IMGs at times are H1, they don't end up matching as third years, or they take time to get their green cards and they do hospitalist years. What do you think is the impact of that? Dr. Chowdhury, Dr. Rahman, whoever wants to take this question.
You repeat the question?
Doing hospitalist years for a couple years in between before applying for fellowship.
I don't think that is a negative. That just shows persistence. So, not everyone matches, at their first attempt, or if there are like visa issues that you're resolving or any other reasons, there could be multiple reasons. You should just really be honest and explain why you chose to be in the hospitalist setting rather than applying directly. But it just shows that you are persistent and you are just staying in the system and just trying and applying. So I don't think that's a negative at all.
I think it depends on the program's prior history as well. I think some program directors who are not international graduates may not recognize that visa is a big factor. And for example, the program where I am, currently affiliated with, our program director, I had to tell him about a couple of candidates who I thought were excellent candidates. And they were on H1B and they decided to get a green card. And basically I had to convince, my program director that, it was not because of lack of interest, it was because of real visa related issues that are real in our part of the world, and immigration being a big factor in terms of our long-term future here. To really convince that was not because of a lack of interest. But even if you do go that route, I would encourage, if you want to go into a hospitalist position, there are specialist hospitalist tracks that are basically targeted towards a specialty you ultimately want to go for. Like there is a GI admitting hospitalist. There is the cardiology hospitalist, there's hem-onc hospitalist. So I think I would encourage you to be that kind of if you want to go for a hospitalist track, go for that routes that really demonstrates that you have an interest for that field in the long term. And also be open about it, as Dr. Chowdhury has mentioned. And lastly, if you can continue your research in that field, and continue to sometimes even volunteer for fellow clinics or something like that, that shows that you haven't lost that trainee mentality. Sometimes the programs are also looking at factors that, is this person trainable again or not? Because he has been an independent physician for a while. So I think that shows that you still have that trainee mentality.
And I actually took this route. I was a hem-onc hospitalist myself. So as long as you remain academically productive, that's most important thing about these processes is we get complacent as soon as we get into these roles. We just forget that we just start focusing on the job. Yes, we all want to do fellowship, but we just forget that getting to fellowship requires work and you need to put in that extra effort. You will have a lot more time in your hand to do hospitalists. Reach out to programs. Like I know some of it could be on a waiver, which could be in a non-academic center, but there are centers around you that you can reach out to people for seeking mentorship and faculty. So next question is kind of like unusual. Would you recommend being entirely honest in your personal statement? Like what if it gets little unprofessional? Dr. Nadir, what are your thoughts on this?
Honesty is the best policy. You have to be always honest and transparent. For anything wrong that has happened in your career, you need to tell honestly about it. Actually, I'll appreciate that.
Even if it gets unprofessional?
We'll have to give example of how is it unprofessional.
Yeah, exactly.
How can you be unprofessional?
If the lie gets caught, you have no chance. Because if you're a liar on your application, I think you are doomed because you have no credibility at that point. So I will be very honest and I appreciate that honesty.
Thank you so much. One last question that I want to ask, because if Monis did present the number of match rates for everybody, that is AMG plus IMG. But if you look at the IMG population, it's much, much more smaller in the specialities that Monis presented. So if a resident goes unmatched, what are they supposed to do over the next 2 to 3 years to build their CVs? 2 minutes each. I'll start off with Dr. Shakil, then Dr. Ikram, Dr. Chaudhary, Dr. Nadir, Asad Bhai, and then we'll sum it up after that.
I think I don't think it'll take 2 minutes, but the time after you did not match, you need to remain academically pertinent and active. I did my J1 waiver before I actually applied for fellowship. So during that time, I was working with residents in an ambulatory clinic, and I was the clinical faculty with the residency program I graduated from. So things like, if you have a project that you want to work on, if you can associate yourself with some of the residency programs or training sites or things like that, just remaining clinically pertinent and active in the field that you choose will count. Like you said, not a lot of us will match in the first attempt. So we all in the programs will look at what you did in the years that you were not. So just building up on what your interest is, building up on a documented, verifiable experience is what we're looking for.
Thank you so much. Dr. Ikram, any secret sauce that you have to share from your years of experience?
I think exactly like other panelists said, that remain academically interactive with the program which is near your. And I think if someone had mentioned that if you go to the conferences, you can always get a list of the conferences from the chief resident or the program. And I have personally seen people coming at 7 in the morning who are not part of the residency or obviously they're applying for fellowship, come, and then very soon people just know them by their face and by their name and all that. And especially if you are able to get involved in some research project at the same time as you're, say, doing a hospitalist work, it all adds. And if you are a cardiology say hospitalist, that will really be very attractive to us, because your maturity as a clinician would be much higher as a fellow if you have done, say, 1 year of hospitalist and then you've published, as well as you've been coming to the conferences. So just show them that you're around wherever you can.
Thank you. Dr. Chaudhary?
I would just agree with everything that was said. If you have a gap between finishing residency and applying for fellowship, you still have to stay academically active and build up your CV with research, and just attend conferences like it was mentioned. So just have to stay relevant. Cannot just be off the radar and then come back 3 years or 2 years later with the exact same CV. It won't help.
Thank you so much, Dr. Nadir.
Yeah, I think you should never give up on your passions. So I will always encourage you to reapply. And actually, I think that shows perseverance, determination, but it has to be sincere, that you are actually working towards your goal and you're showing that with hard work. So I really like people who are reapplicants, because to me, they're really trying very hard. Thank you.
Thank you so much, Dr. Iman.
Yeah, I think I agree with everything that was said. I think honesty is very, very important. You have to then have a very objective review of what your application was, and really maybe even have somebody else take a look at it and really identify what areas were that probably could be improved for next year's application. Many times, of course, it's research, which you can, of course, improve. You cannot improve your step scores. You may not improve, your clinical rotations as a resident, but research remains one of the avenue. In today's day and age, social media is so powerful. I think if you appropriately utilize that in gastroenterology, there are several like on Twitter handles that basically are geared towards trainees. They really get them connected to mentors across in different institutions. It allows you to, make rapport with those folks and ultimately get more research through that route. So I think, having somebody close to you who can really objectively tell you what areas are important to work on, and then subsequently, expand your horizon, reach out to other places. If you want to do a hepatology fellowship, mortality for GI, or you want to do a chief year, that's completely up to you and a matter of debate. But I think you have to keep moving forward and just, apart from, the setback that you just received, try to focus on things that you can improve.
Monis actually went through this heartbreak as well, along with me. So Monis can share his views as well.
Yeah, I think now the recently ECFMD has changed that you cannot do a non-ACDME fellowship on J1. I think it's a developing thing. So let's see what happens. But for me, when I was deciding, I wanted to go into program like where I would be clinically very very active, and then I would have a chance of getting matched into that program. Let's say I'm being honest. So let's say if I was getting an offer from of vascular medicine from Mayo, it was not worth it because Mayo is not going to take me. I'm being honest. And then instead, I took a heart failure fellowship in the University of Louisville. So I know that's a matchable program from IMG, and then it really worked out. But and then for the chief resident, if you want to go for a chief resident and at some other place, I would not recommend that because in first of all, going to some other place, whether they have the in-house fellowship or not, even if they have the in-house fellowship, you will be competing with their own third-year residents who are there for the last 2 years, and you are just a new person just landing there, getting into the competition. So I have seen like few examples that did not work out.
Thank you, Monas. You bring up a very relevant point. Assess the circumstances. I went unmatched as a third year. Literally mourned for a day, like literally cried for 24 hours, stood up again, made my CV, applied for 6 hospitalist jobs. 5 of them were hem-onc hospitalists. I got 4 offers, assessed my chances, where I will end up matching, where I'll find good mentors, ended up in Medical College of Wisconsin, and then I became a fellow last year. So I would recommend, whether it be hospitalist, whether it be chief year, whether it be a sub-fellowship that is non-ACGME accredited, assess your chances. What are the chances that they will convert into a proper fellowship position? So I think we have gone 5 minutes above our allotted time. I would like to thank all the panelists for sharing their time. There are a few questions that are left, but we'll be more than happy to take them in the Facebook group. We just made a fellowship WhatsApp group as well. I posted the details in the chat. You just need to fill out the Google form, send us a request to join that WhatsApp group. We will check it weekly and add people to it. So use that, ask questions. There is one-on-one mentorship available in that group. We have people from all specialties, peds, neurology, everybody's there. So try that avenue, try the Facebook avenue. And of course, we all are here for answering questions as well. So thank you everyone for your time. It was a pleasure meeting you all virtually.
I think Noman Bhai might have to add
Thank you.
some. Yeah, thank you.
Just wanted to thank everyone. So thanks, Monas and Gulrez, for conducting a very successful session. And I really want to thank all the panelists, Dr. Shakil, Dr. Nadir, Dr. Rahman, Dr. Chaudhary, and Dr. Ikram, for taking out the time on a busy Sunday. It's a Memorial Day weekend. So thank you very much. It was really good. We answered a lot of questions. So hopefully all the people who joined, they will find it helpful. The recording will be available on our Apna YouTube channel as well. And as Gulrez mentioned multiple times, please join our Facebook group. And if you have questions, please ask over there and we'll be happy to get back to you. Thank you, everyone.
Thank you.
नोमान भाई ये बता दें कहाँ खाना खा रहे हैं अभी?
खाना खा रहे सबाबा में.
पता था मुझे, पता था. चले.